Hi, this is Dr. Giuseppe Marinacci of Biohealth Holistic Dentistry. More and more dentists are claiming to be holistic or biological, but unfortunately sometimes it's just a marketing strategy. So how can you really understand if your dentist is a true biological dentist? So I'm going to give you 8 tips, so please watch all the video because the last one is the most important one for me. So first of all, a true biological dentist has a metal-free approach. So at least all the permanent components like implants, crowns, bridges, orthodontic retainers, they should be metal-free. A biological dentist not only remove metals from your mouth, but they should help you detox the metal particles from your tissues after removing the source of them. For example, if you have mercury fillings and they remove your mercury fillings, after that they should help you detox the mercury that is still stored in your tissues. A true biological dentist wouldn't remove any teeth, wouldn't perform any surgery, any implants, if they don't first ask you to have a blood test and make sure that your immune system is good enough to deal with any infections, to deal with bone healing, etc. In particular, they will ask you to have high levels of vitamin D, and if your vitamin D levels are not in the right range, they would ask you to increase your vitamin D levels first. Vitamin D is extremely essential and important for bone regeneration, bone healing, and to boost your immune system. Also, a biological dentist doesn't rely on antibiotics, but they rely on ozone therapy. Biological dentists, they would implement IV therapy as well in their treatments, like for example vitamin C, glutathione, etc., etc. A biological dentist doesn't believe in root canal treatments. Why? Because it's a fact that it's impossible to fully decontaminate the root canal system in each root. That's why bacteria can be left over after a root canal treatment and they can be spread to the rest of the body, causing potentially some kind of issues. So a root canal treatment for a true biological dentist, it's not an option. Finally, a true biological dentist would use the autonomic response testing, which is a sort of advanced kinesiology test to test your mouth, to see if there is any relationship between your infected teeth and the rest of your body. They would test the dental materials for biocompatibility before using them, and they would test any possible remedies needed to detox heavy metals. At the same time, they would use the autonomic response testing during surgery, for example, during a dental extraction, to make sure that the bone left is not testing anymore for any kind of germs, and that bone is healthy enough to be used, for example, for an implant. And in that case, they would avoid the potential development of a cavitation or any other kind of issues or an implant failure. Okay, I see many patients coming from other biological dentists, and when I test their bones, sometimes I can still find some kind of contamination, and that's not good because it means that bone needs to be reviewed and needs to be cleaned again and again before doing any other kind of treatments.